We'll have Dr. Thomas joining us now by phone. He is from Upstate University Hospital. We thank you so much for being here. We know that we are practicing our social distancing, so we thank you for waking up this morning and joining us by phone. So 2 confirmed cases here in Onondaga County. What, though, is the latest now from the county? I know that you all are meeting constantly. Any updates now that people need to know about?
Good morning. So you're correct. There are 2 confirmed cases. There are no other confirmed cases, at least as of 4 o'clock this morning. I can tell you that all of the hospitals are they are seeing people with respiratory symptoms, and they are swabbing those people, and they are sending those tests off. So far, those tests are coming back negative, but there is clearly an uptick in the number of people who are coming to the emergency department with fevers and/or respiratory symptoms.
Dr. Thomas, what about the capacity of our local healthcare system? So far, so good, and how does it look going forward?
Good question. So every hospital has, especially the hospitals around here, they have a surge capacity. So they can surge anywhere from 15 to 20% above what the normal numbers are that they see on a routine day. Although we are still seeing more people with respiratory symptoms, we really have not reached that capacity as of yet. And the goal would be to not reach that or exceed that capacity. And that is the entire theory behind social distancing and trying to, quote unquote, flatten the curve. So we know we're going to have more cases. We know that we're going to see people who have a COVID diagnosis. But if we can keep those numbers below what the healthcare infrastructure capacity is, then we will be able to continue to take care of those people and take care of patients that do not have COVID disease but still need to be in the hospital.
So, Dr. Thomas, you talk about people going into the ER. We talk about social distancing as well and the importance of that. What would you tell people if they are feeling symptoms? What would you tell them to do to practice just a safe protocol in terms of getting tested, or if they're fearful that they might have COVID-19?
That's a very good question. So the first thing that they should do is they should try to distance themselves. Let's say they're at home, they wake up one morning, they have feelings of fever or cough or just a general sense of not feeling well. They should try to distance themselves from the rest of the family or whoever is living in the house. What I mean by that is try to get 6 feet in between each other. Make sure you're washing your hands a lot. Wipe down surfaces in the house that are common contact areas. The next thing that you should do is call your primary care provider. That's the first thing that's the next thing that you should do. They will give you some guidance on what their interpretation of your symptoms may be and whether they feel you need to come into the primary care office, be seen by them, and potentially be tested. If you don't have a primary care provider, the Upstate COVID triage line, you can call that number as well, and that's on the Upstate website. That is a phone bank with medical professionals who can hear what your concerns are, and then they can give you some guidance. The Syracuse Community Health Center is also open. You've probably seen that on the news. They're not a 24-hour operation, but they're open for a number of hours through the day. That is another location that people can go to get some guidance about their symptoms and to be tested. And then all those different groups, the triage line, your primary care provider, the Syracuse Community Health Center, they can let you know whether or not they think you need to go to the emergency department. What you should not do is immediately get in your car and run down to your primary care office, or immediately get into your car and run down to the emergency department. You will overload those medical care resources.
Doctor, finally, those of us who are symptom-free, we feel just fine, thank you very much. It's important to know that we could still be carrying the virus and never know it, right?
So that's true with lots of infectious diseases, that people can be infected, they can be asymptomatic, and they can have the potential to infect others. That is true. And again, this is one of the tenets of social distancing, is to try and allow whoever is infected to get through that infection and to recover, to try to prevent new infections from occurring and to just break the cycle of one person infecting another. This is also why it's incredibly important that everybody, regardless of whether you feel sick or feel well are constantly practicing good hand hygiene, washing your hands with soap and water and an alcohol-based gel as often as possible, while you should practice good respiratory hygiene, covering your cough into your sleeve or a sneeze and washing your hands afterwards, while you should try to avoid touching your mouth, your nose, your eyes, your face. So even if you feel well, you should still be practicing those things so that we can try to break the transmission cycle and flatten the curve.
All right, Dr. Stephen Thomas from Upstate University Hospital, thank you so much for joining us this morning. We know that we'll certainly be hearing more from him throughout the day.